Namaste and welcome to the video on markings of radial artery forearm flap. So first of all, we will mark the axis of the radial artery along which the flap is going to be outlined. So for this, first point is the midpoint of the cubital fossa, and that is proximally, because the course of the radial artery is going to be in a gentle curve towards the radial side and then it will go distally towards the wrist crease. So proximally we have the midpoint of the cubital fossa, and distally we have the distal part of the radius near the wrist crease, which is at the radial styloid process, and here you should be able to palpate the radial artery. Now this is going to be your surface anatomy or the outline for your flap marking. Now conventionally the radial artery forearm flap was centered in such a way that the radial artery comes in the middle of the flap, but it is not necessary. You can have it with some variation where you can include more skin on the ulnar aspect as well, or a little bit on the dorsal aspect. Traditionally you can go up till the ulnar aspect where the non-hair bearing skin is also there. Distally from the wrist crease, it is advisable to leave at least 1 centimeter so that you don't encounter the superficial structures and there is less risk of exposure of the tendons. Now if this is the axis of the radial artery, then where will the cephalic vein be and where will the flap be marked? So this is going to be the gentle curve axis of the radial artery. And this, as we discussed in the previous video, is going to lie between two important structures. One is the flexor carpi radialis and the other is the brachioradialis. So you can already see this prominence. This is of the FCR. So between the flexor carpi radialis and here on the radialmost border you're going to have the brachioradialis. Now brachioradialis is going to be muscular in the upper and middle 1/3 and tendinous in the distal 1/3. Radial artery is going to be between FCR and brachioradialis distally, and the pedicle all along its length from where the perforators of the septum arise are going to be below the bulk of the brachioradialis. So brachioradialis will be retracted throughout its dissection to be able to get the pedicle out. So now where does the cephalic vein lie? The cephalic vein is going to be radial to the radial artery. You can find it in most patients, it will also be visible, and there will be vena comitans along with the radial artery, but the cephalic vein which we must harvest for better venous drainage will also be found radial to the radial artery. Now the important structure which we had discussed that must be preserved so that painful neuromas are not there is the superficial branch of the radial nerve. So one branch that goes to the dorsal aspect of first metacarpal may be divided, but it has to be preserved, and it can also be done when you harvest it suprafacially. Now the outline of the flap, like I said, we leave 1 centimeter. And you can go a little bit to the ulnar aspect as well. You can include some aspect on the dorsal part, depends on what is the length of the flap and the dimensions of the flap that are required. You can shape it depending on what is the purpose of the flap. You can also typically go up till the entire part of the forearm to harvest the flap. Now where will you begin the dissection? Will you go on the radial side or the ulnar border? This is again a personal preference among surgeons. So some prefer to begin the dissection from the radial border of the flap, preserve the superficial branch of radial nerve, find the cephalic vein, divide it, then go and find the radial artery vena comitans, and this is all done in the distal part. And once you've identified the pedicle, then the remaining can be completed from the ulnar border. But some surgeons prefer that you go to the ulnar border so that you can easily identify the radial artery, the pedicle from underneath, and then you complete the radial incision. But distally to proximal is the direction of the flap that will be harvested. Remember, we can keep it suprafacially to preserve the fascia and paratinon over the tendons distally, but along the length of the pedicle to harvest the septum and the perforators we go subfacially. Flap harvest is done under tourniquet control, and after the harvest the donor site is covered with a split skin graft.